Wars, floods, drought, airline, and FAA chaos. We've grown used to these and other apocalyptic stories sweeping the country and the globe. But it's an ideas piece in Time magazine called The Coming Collapse of the U.S. Healthcare System that has everyone in healthcare abuzz right now. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. A robust show that's definitely not collapsing. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens South. David, what is all the hubbub about? Are we really at the point? I mean, look, there's floods in California. There are planes that are grounded, but our healthcare system's continuing to perform. What's all the buzz about?
I'll tell you, John. Well, here's what the article says. It struck a nerve. So it paints a picture of somebody. There's always good articles, a good story. If someone has a heart attack at 4 a.m., they're transported 45 minutes past two hospitals that had closed down. When they get there, it's overcrowding. There's no ICU beds. The cardiac unit is browned out because they have a lack of staff. So that's kind of the portrait that it paints. And like, oh my God, this is happening everywhere. And they talk about root causes being basically staffing and what happens during the pandemic and so on. So that's the kind of thing. And they say, why isn't this a major news story? Now it is.
Well, David, are you afraid of getting care in the People's Republic of Massachusetts?
John, I've always been. I've never wanted to go to the hospital. I think going to the hospital is a sign of failure, by itself. So, yeah, I'm always concerned about going in. The idea about hospitals being dangerous sort of predates the pandemic. The thing that they say about the root causes being the staff not feeling valued. They talk about nurses striking. That strike, I think, has just been settled. They talk about travel nurses shutting down the services, big waits for everything, burnout going on. Yeah, it's true, but I don't think the system has actually collapsed. But no, I'm in no hurry to go to a hospital, John.
But I do think that it raises. I mean, maybe in an apocalyptic kind of the world is on fire, hair on fire kind of way, there are some issues embedded in there that are important. I mean, the fact that, a third of all nurses, if you ask them whether if they could retire, would they retire today? Would. The fact that we have so many more people turning 65, 10,000 people turning 65 every day. And, if you roll the tape forward, we probably don't have enough doctors and nurses. The issues may not be apocalyptic or critical today, but certainly there is a supply-demand dynamic that I'm worried about in terms of doc and nurse supply. And if you look at the UK right now, it is at the point of collapse.
Yeah.
People are, elective surgeries like a year out in the UK and 2 years out in Ireland. There are rolling strikes at the NHS level. I mean, if you don't deal with this supply-demand dynamic where people's needs versus the system's ability to provide for it early, you can't just add doctors and nurses on demand. You have to train them. You have to create those educational alternatives. You got to give them the opportunity to train in the field to support the demand that's coming. So although it's a little bit over the top, I do think it raises some issues that we ought to, as a country, start to think about dealing with.
For sure, John. I think the point here is that when the costs are totally out of control, right? This isn't like, okay, we cut costs 20%, now we have these problems. No, cost is basically unconstrained, continuing to rise and erode all the other possible things that we could be spending money on, and we still have the problem. That, to me, is the real crisis. There's some things that they say in there that are just not correct, though. So one of the things is they say, well, the nurses are upset because they have to have a vaccine mandate and they don't have autonomy, so they're not being respected. There are certainly some people that think that way. On the other hand, I think one of the causes of burnout was that while the healthcare providers were taking all sorts of precautions, working around the clock, they're seeing people that would come in because they hadn't been vaccinated, because they didn't wear masks. And then they're saying, well, gee, we're going to all this trouble. And look, people aren't taking things seriously. There's other things that are incorrect in the article. So they talk about how, nobody wants to go into medicine anymore. And that's just not the case. In fact,
that's not the case at all.
No, there's been a huge increase, an 18% increase in medical school applications. It's actually, the increase is led by historically underrepresented minorities. And there's a 25% increase in nursing school applications since the start of the
and we could probably fill the average we could probably double the size of the number of medical school students with qualified applicants if we increase the number of slots.
For sure, John. So I think that's that's absolutely right. So there's enough people that are interested. Now, there are problems like medical school is very expensive. That's an issue. Even on the first thing, the way they start about going past 2 hospitals that had closed. First of all, there's about 20 hospitals that close per year over the last several years. So if you went by 2 of them, that means you went by 10% across the whole country. Hospitals also, when you get to a hospital, that's a failure. So you don't actually want to get to that point anyway. It shouldn't be such a hospital-centric system.
You really don't like the authors of this story. You think they're just bloviating, basically.
They're professors, and they don't cite any statistics or any sources at all. And I don't know if whether Time Magazine just cut them out. It's because the facts actually go against what they're saying, even if they have some points. And in fact, one of the things that you could prescribe is to have less of certain, news channels.
Professors, you're basically an anti-professor.
I hate that. Yeah, that's it, John. I'm an anti-intellectual in that way. But John,
yeah, how about immigration?
It serves to reason that one of the causes of shortage, not necessarily of physicians and nurses, but more broadly about in the U.S. healthcare economy, including home aides and others, is the number of immigrants has been reduced because we have policies that don't make sense. So more immigration would help, John.
Yeah, I mean, there's no question. If you look at the qualified folks who want to serve as nurses and doctors, there's thousands and thousands of them. I think it's like 10,000 stuck in the immigration system. That basically, since the 90s, we've cut the number of legal immigrants by more than half. I mean, it is your ability to grow the economy. One of the inputs is how many employees you have, and we're reducing the number of employees, and even more critical, we're reducing access to some well-qualified nurses and doctors from abroad. It just doesn't make any sense. But I think there is some merit, David. If you forget the apocalyptic approach to the healthcare system is collapsing. We do have, if you combine the growing labor shortage, the fact that in rural areas you actually do have a challenge keeping hospitals open. I do think that there are with an aging population, you're going to have more needs. You're going to need more doctors. You're going to need more tertiary support. I don't think it is completely unfounded. Although again, the meandering apocalyptic whine of the professors that you so enjoy, is irksome. I mean, the notion that somehow that you'd say, well, the people aren't respected because they don't choose to actually get a vaccine at the same time. I mean, the whole thing is just sort of seems like sort of silly.
John, it's like a random walk to the apocalypse. The article talks about how nurses aren't well paid and not well taken care of, and then it talks about travel nurses making 3 or 4 times what other nurses are making. It talks about locum tenens physicians. Well, to me, it also seems, there's a lot of labor market flexibility. So they are well paid because you can go and if you want to make money, you can go.
Well, again, it's you and your Latin phrases aside, locum tenens yourself.
Mr. Irksome,
I think that what you ought to think, what the point that they're making is that when there's a labor shortage, you end up overpaying for the people, the doctors and nurses on demand that you have to do to fill those jobs. And it does create a sort of a painful comparison when you're working on a ward late at night with really difficult issues at a third the wages of the person next to you who's only going to be there for a month or two. That sure. is, you may not understand what irksome means, but you would if you were in that situation.
It doesn't sound Latin. I don't think they have that K. But John, there's a few things that are there besides, immediate, in an immediate case, they can't open a bed because they don't have a doctor or nurse there. So I think there's a few things that are needed. One is to have, tools that can support people so that they're not spending 30% of their time, typing stuff into a computer. You can have AI that means that you can get to diagnosis faster. And you can have better other technologies, like better use of the right pharmaceuticals, so people are not ending up in the hospital in the first place. So, and the hospitals haven't necessarily managed things that well on their own. They don't have the greatest management practices, and that's another source of trouble. And there's also
none of this ties to the end of the world. The Time magazine. I mean, what are they trying to do here, David? I mean, it just seems like, are they just trying to grab a headline?
I would assume that is their business. But John, the other part, I think, from a structural standpoint, and I got lost and was trying to remember how to say it in Latin, but was the fact that the hospitals rely so much on procedure. So the apocalypse is that they were not able to do elective knee replacements, for example, or other sorts of orthopedic specialties and other procedures that actually make a lot of money for them. That's what's caused the problem. And the staffing is part of it, but that is not the main issue.
You're just anti-hospital, David. I mean, come on. We need hospitals. If it was your knee that needed to be replaced, you wouldn't call it elective. You'd call it necessary and mandatory. I mean, come on, dude. We need hospitals. We can't be without them. I mean,
sure.
Yes, they're dangerous. But I think there's a genuine emerging labor crisis that we got to deal with.
All right. So we'll do it, John. We'll have immigration. We'll have
check.
Better IT tools and other sorts of tools that.
Oh, now you're in favor of technology because maybe it'll help you avoid the hospital.
I was listening to our brilliant podcast on artificial intelligence in healthcare, and I thought, hey, here's a use for it right here. So yeah, and I think fewer pandemics would be great, John, and maybe that could be brought down to reducing climate change, keeping the world a little cooler so the new viruses don't emerge, et cetera. So why don't we do that?
You Pollyannish prognosticator, you.
Yeah. Well, I don't know, John. I think that that it's raised some important issues. It's clearly, struck a nerve. I would say that one of the things, if you want to focus on that supply side, let's actually enable people to go to nursing school or medical school if they're interested in it, and let's make it that the career is something that's sustainable, including
you don't have to borrow the equivalent of a condo in value in order to actually get an education to care for people. It's sort of nuts. But David, it didn't just strike a nerve; it found a nerve and dug it out. I mean, the article was sort of dopey in its sort of screed about the collapse of the system. There is a collapse of a healthcare system. It's in the NHS in the UK. It's not in the US. So let's invest in those doctors and nurses and that capacity to educate and train and support those doctors and nurses, and invest in a way that doesn't bankrupt them early on in their career, so that we can keep them caring for folks like you as you age. Dave, you're looking kind of old in the picture right now.
Thank you, John. I appreciate it. So I think that's a good place to, at least my hair's not on fire as you were saying before. I say, John, that's it for yet another episode of CareTalk. I can sleep better tonight knowing that the apocalypse is not coming until sometime down the road, maybe next week or the week after. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. If you like what you heard or you didn't, please subscribe on your favorite service.